This is Healthcare Bill, part number 33, and as you know, I was scrolling down through a whole bunch of stuff the last time I made a video, and now we're going to pick up the section where it says not counting periods before significant breaks in coverage. It says, in general, a period of credible coverage shall not be counted with respect to enrollment of an individual under a group or individual health plan if after such period and before the enrollment date there was a 63-day period, all of which the individual was not covered under any credible coverage. So, what happens is, when your old coverage ends and your new coverage begins, if there is a 63-day period where the guy was not covered at all, then that coverage, that period of time is not going to be considered credible coverage. Okay? Waiting period not treated as a break in coverage. For purposes of this subparagraph A and subsection D4, any period that an individual is in a waiting period for any coverage, okay, he is waiting for coverage. He hasn't quite got it yet, but he knows he's going to get it. All right? Under a group or individual health plan, or for group or health insurance coverage, or as an affiliated period, as defined, shall not be taken into account in determining the continuous period under subparagraph A. So, a waiting period is not considered credible coverage. Now, it goes down here, and it talks about TAA eligible individuals. Now, what is a TAA eligible individual? Well, the Trade Adjustment Assistance Program, okay, was a program designed for people like people in factories. If their trade suddenly went out of business because people didn't want certain kinds of cars anymore, or certain kinds of materials or whatever, and they couldn't get back into their field of expertise because their field of expertise just disintegrated, then this Trade Adjustment Assistance Act would provide them with compensation and try to help them get employed into another trade. Okay? So, and obviously they have health care coverage through this Trade Adjustment Assistance Program, and that brings us back to this. In the case of plan years beginning before January 1st, 2011, we have the TAA pre-certification period rule. In the case of a TAA eligible individual, this is part of the Trade Adjustment, let me say it again, the Trade Adjustment Assistance Program, okay? The period beginning on the date the individual has a TA-related loss of coverage and ending on the date that is 7 days after the date of issuance by the Secretary or by any person or entity designated by the Secretary of a qualified health insurance cost credit eligibility certificate for such individual for purposes of Section 7527 of the Internal Revenue Code of 1986 shall not be taken into account in determining the continuous period under subparagraph A. So, if they lose their TA loss of coverage and they are going to get another coverage, that is not a period of credible insurance. Okay? The terms TAA eligible individual and TAA related loss of coverage have the meanings given such terms in Section 2205B4. Method of crediting coverage. There are two methods. The standard method, which says, except as otherwise provided under subparagraph B for purposes of applying subsection A3, a group health plan and a health insurance issuer offering group or individual health insurance coverage shall count a period of credible coverage without regard to the specific benefits covered during the period. So in other words, they're talking about a period of credible coverage. It doesn't matter what coverage you're getting, and in the line of specifics, if you're not getting heart coverage, but you're getting coverage for your limbs, so on and so forth, you got certain kinds of coverage, but not others, that's still a period of credible coverage. Election of alternative method. A group health plan or health insurance issuer offering group or individual health insurance may elect to apply subsection A3 based on coverage of benefits within each of several classes or categories of benefits specified in regulations rather than as provided. Such election shall be made on a uniform basis for all participants and beneficiaries. Under such election, a group health plan or issuer shall count a period of credible coverage with respect to any class or category of benefits if any level of benefits is covered within such class or category. If you can make heads or tails out of that, go for it. And you are more than welcome, let me pull this up here, to tell me what you think right down here in the comments below. And I think I'm going to stop this right here, and I will tell you more in a future video, so stay tuned.